Hey guys, today we've just got another educational video. So we're going to be showing you a real life example of someone who's come in for a functional assessment and having problems with their back, knees, hips during a squat and a deadlift. And we're just going to show you the tests that we did to determine exactly what the problems were with this person and outline some of the steps to help move her away from a possible injury. So I'll get the disclaimer out of the way first of all. So I'm not an expert on injuries and I don't claim to be. I'm just an educated movement and performance coach that can spot technique that is going to lead to an injury at some point if they continue to maintain it. So the majority of injuries are caused by ineffective movement. So if we can stop having that ineffective movement, then we're going to decrease the risk of injury and therefore increase performance in the gym. And that's what I'm completely passionate about, increasing that performance. So it starts with building that platform of good technique to start off with so that we can get that increased performance in the gym and get those outcomes that we're looking to achieve. So I don't claim to be an expert. I work with experts and refer to the experts on specific injuries. So the method I use is just to outline risk of injury in the future. If it is at a point where you have done some damage, then I will definitely refer you on to someone whose specialty is in that area so you can get that fixed as soon as possible. I'm primarily working with people who are getting some kind of pain from exercise and moving them away from that. So just looking at an example here, this is someone who's actually got a trainer and they come booked in for a functional assessment, and we can notice a couple of things here. Far left one, not getting very far on a waiter's bow, not getting good thoracic extension on the middle photo, and then knees coming in on the last photo, so that's internal rotation of the knee. It's not what we're looking for. If we're looking at her squat here, there's a couple of things that we need to look at. She's got a bit of a rounded back there and her toes are pointing out quite far. Also, she's not getting very deep. So her trainer was telling her that she needs to get deeper, which with her mobility and movement patterns is impossible without pain. So if we look at, we just did some mobility work here, and we can see that her feet are still in a ineffective position, but her back's in a much safer position. It's much more upright. She's not rounding through her shoulders there. With her feet pointed out there, she's just not getting any external rotation through her knees, so she's not going to be able to get deep enough, so her glutes aren't going to be activating correctly. By releasing her glutes, we will fix this momentarily. However, we need to change the programming to be able to fix this long term as well. The technique in programming caused this issue, so it's going to fix it as well by changing that technique in programming. So if we're looking here at a deadlift, just looking at the bar path, she's got a very bad bar path here, so we're going to be looking at that, and she was getting back pain doing this even with that extremely light weight that she was using. So we just made one quick little tweak to it to be able to get the better results and get a more effective bar path, which we're going to show you in a second. So if we look here, we can see on the left a bad one, on the right it's much more effective bar path, and that was just with a simple technique and setup change. It dramatically changed the results, and she was shocked at how I removed her pain during that exercise that her trainer couldn't fix. So we can see here on the right, shoulders are in a much better position. She's rounded over. On the left here, as you can see, much better position, much safer position, and her pain has gone away. So it's a great result. So this is just what happens in a functional assessment. You'll find 98% of trainers don't actually know how to do anything like this and know nothing about it, which is why we've had someone come book in for a functional assessment and be shocked that within 15 minutes we can remove her pain on certain exercises that she was getting, which her trainer could not do. Do you get pain from exercising? If so, just leave a comment on this video and maybe I can point you in the right direction. Who is the best person to see to be able to get assistance in overcoming that pain?